welcome to the Cannabis Nurses Network Members Spotlight, where we shine a light on the trailblazers transforming healthcare through advocacy, education, and research. This year, under our guiding theme, Honoring the Past, Leading the Future, we recognize the legacy of nurses who have challenged the status quo and uplift those who are boldly shaping what's next. In alignment with our monthly theme, Cannabis Science and Research, we are honored to spotlight Dr. Renessa Williams, PhD, RN, a nurse researcher and educator. As an assistant professor at the University of Miami School of Nursing and a lead investigator of the Cannabis Nurse Task Force, Dr. Williams is pioneering research at the intersection of cannabis use, health equity, and immune function. Her NIH-funded CUPID study focuses on cannabis use and proximal immune dysregulation in Black sexual minority men living with HIV, centering on voices often overlooked in both science and society. Let's welcome Dr. Renessa Williams and dive into the conversation that honors the past and boldly leads the future of cannabis research and nursing. Welcome, Dr. Renessa.
Oh my gosh, thank you, Heather. I can't thank you enough. This is such an amazing opportunity.
We're so excited to have you here. And, you really are doing groundbreaking research. So let me start by asking this first question. Dr. Williams, your research at the University of Miami is pushing boundaries in cannabis science. What drew you to study and research cannabis as your focus?
Oh man. Do you want the long answer or the short answer? It's a lot. So I will say I didn't start out as a cannabis researcher right away. I really was like a stigma researcher. My work started in the HIV field, and I was really in my work, I was finding that when people are devalued and stigmatized, it leads to poor health outcomes. It even, whether you acknowledge this hurt and pain that one may be receiving um, from stereotypes and prejudices. In my work, I was finding that it just gets under the skin. So by that, I mean it can lead to changes in your DNA, inflammation, and other markers of health. So with that being said, I started out with HIV stigma, and I realized that HIV stigma specifically wasn't really the whole story. A lot of my participants naturally during like my qualitative research interviews, I was finding they were expressing to me that they experience other types of stigmas or racism, prejudices, and they'd often perhaps use cannabis, for example, to cope with some of these stressors of life. So that was really interesting to me because when I was a student at the University of Florida, I started kind of getting into cannabis research because one of my mentors, Dr. Robert Cook, he was a huge cannabis researcher here in Florida, a superstar, who mainly worked with people who were living with HIV and used cannabis, and he has some really cool stuff going on there. And at the time when I was a student, I asked my mentor, may I work with Dr. Cook to explore maybe stigma and cannabis use? And my mentor at the time said, no, like cannabis will never be federally legal. You're never gonna make a career out of it. Um, and all of these things that I'm sure everyone has heard in their careers too. So it kind of scared me away from the profession when I was really young, but even in my own personal experiences, I have a Jamaican background. You know, my parents fully believe in plant medicine. It's what I grew up around. My family, they're cannabis farmers in Jamaica. So a lot of just cognitive dissonance with what I received in academia and what my personal experiences were, as well as the personal experiences my patients had with cannabis. So that kind of frustrated me, but at the time I just didn't want to rock the boat. So when I graduated with my PhD, my dissertation was on HIV stigma, and I found really surprising things about HIV stigma and its impact on like physical and mental health. But when I entered into my postdoc, I had other mentors here at the University of Miami. I had Dr. Denise Vidot and Adam Carrico, who really encouraged me to explore new areas of my research. And cannabis just came up again in my research. It kept coming up and coming up and coming up. And this was in, oh gosh, 2022, I think, that I realized, I think just seeing Dr. Vidot, especially, I'm not sure if some of you are familiar with her work, but she's also a superstar cannabis researcher. And she shared with me some of the challenges she went through as a cannabis researcher, as a cannabis epidemiologist at UM. And she's just broke through so many barriers to where it felt okay to delve into this work. If she made like she set the opening of some sort so that other people can do this work without feeling judged or stigmatized. And it's not perfect, but I certainly just felt like it was something I could do now in my career, especially now that I graduated. So she along with other folks encouraged me to write a federal grant to look at cannabis use and its influence on inflammation in the body. And this was important to me because people living with HIV, they already have this elevated immune response. And we already know there's a lot of research supporting the fact that cannabis can help mitigate inflammation in the body. So I thought this would be a cool avenue to explore using federal funding, kind of proving the naysayers wrong. So at the time, I still wasn't fully, I was still a little scared because, yeah, federally cannabis isn't legal. Um, but I decided to submit that grant anyway. It was a grant specifically for like nurses or physicians who want to explore a new area of research. And they can be mentored by someone in that specific area. So I figured, why not? I'm going to try and see what the federal government says. So I submitted this grant. Specifically, it was in the population of Black sexual and gender minority men in Chicago. So the grant is completely, up north where cannabis is legal recreationally and medically. And I submitted the grant, and it got a great score, but they didn't want to fund it. And it was the National Institute of Health. So when I spoke to the program officer about the grant, what can I do to improve it next time? I'm going to submit it again. I really believe in it. She said this grant was really good and it should have been funded. But a lot of the reviews I got were really, how should I put it? It was uneducated. So I still, there was just a lot of stigma there, of course, as you can imagine. But I took the reviews and I reformulated the grant a little bit, taking all that in and maybe skewing it in a way where it was a little bit more balanced. And what I mean by that is the reviewers thought, maybe I shouldn't focus so positively on cannabis. Like it should be a more balanced approach. Like maybe it won't help with inflammation. That's what I should talk up more, if that makes sense. So I did that. Um, and yeah, I did that and I ended up getting an even better score and the grant was funded. So that was kind of my first experience into the cannabis research field and my first taste of, not only personal stigma, but realizing it's just every level there are people who just aren't really getting it, who may be uneducated and who should be educated, but they're not. And they really try to keep you down from progressing the field in general. So, but that kind of made me want to do this work even more. So, yeah, that's how I got into the cannabis research field. I just had personal experiences with cannabis as medicine, and just in academia, there were some roadblocks with people kind of steering me away from the field, but it just kept coming up like in my patients, in my work. Um, and I just believe in it so much then, and that's why I wanted to do it. I think we don't do enough looking into the benefits of plant medicine. Rather, we focus on the negatives. So that's why I wanted to do this work.
So my next question for you would be then, how do you see your research contributing to public health policy, especially in terms of addressing stigma and health disparities related to cannabis use? Do you see how your research can contribute to public health policies?
Oh my gosh, I hope so. I mean, that's one of the reasons why I wanted to form the Cannabis Nurse Task Force. Dr. Vido is a huge contributor to this group, as well as you, Heather, Laura, Ivory, Dr. Lakeisha, Janester Wilson King. I wanted to put together a group of just cannabis nurses who have been doing this work for decades, as well as physicians and naturopaths, because you guys are know a lot about how to navigate this landscape. You know, you've been through just the stigma and the keeping you down, and I feel I wanted to really highlight that in the research, because that's, if you look in the literature, PubMed, you know, Web of Science or Google Scholar, you look up cannabis nursing and you don't really see much. Um, you see a lot about pharmacists' role in cannabis medicine. You see maybe things about dispensary employees educating patients about cannabis medicine, but in my professional life, I know the role of cannabis nurses is incredibly huge and impactful. You know, nurses are at the front line in health. So, with that being said, I wanted to form this group because I do want to move the needle towards public health policy and kind of helping us as nurses become more elevated in research, because we're here in practice and we're loud and we're proud, but um, I want to show policymakers that there's evidence that shows that cannabis nurses are doing the things. We're doing all the things and we're educating patients, and there are good health outcomes that come out of that. So with this group, really the purpose is to bridge the gap between research and practice and also education. And what I'm hoping to do is to just use this as a platform to elevate the voice of the cannabis nurse in different settings that maybe people wouldn't expect. So, like at conferences, there's the Council for the Advancement of Nursing Research Conference that's coming up in Washington, D.C., that I just found out our work will be highlighted there. Yeah. So hopefully we all get to go to DC and talk about cannabis nursing in November, I think. So I think, especially what I'm learning from the wonderful ladies that I work with, is that to move public policy forward, we just have to elevate our voices in different areas, not just the areas that we constantly congregate in, where we know about cannabis nursing and about cannabis as medicine and its benefits, but in areas where maybe we'll feel more stigmatized in, or like settings that maybe people aren't as educated about cannabis as medicine. So that's going to be hard, And maybe scary, but I'm excited. It's necessary. There's seldom people who move the needle forward that don't get pushback or, or a fight. So I'm proud to fight with you ladies in these areas. Um,
Yeah, thank you for leading us in that fight as well. And, I think it was Brene Brown that said you can't be brave if you're not a little bit scared, right? So you have to be a little bit scared to actually prove your bravery. And, thank you for being a brave leader in this realm. You're not only a researcher, though, you're also an educator. So how do you approach cannabis education in the academic setting? And what do you believe nursing students must understand about cannabis science today?
oh gosh. That's a good question. I consider myself a baby educator. So I'm actually starting to, along with Dr. Vidal, my colleague, we're starting to try to implement learning about the endocannabinoid system in undergraduate programs, nursing programs, and public health programs. We currently don't have anything in our school. So we're going through the process of implementing a course to educate these students about the endocannabinoid system. And I think that's a good starting point. And it's something I actually learned from you all, because I think a good starting point is just learning about the endocannabinoid system. That's how I started out getting curious about cannabis as medicine. And I think these students learning about the endocannabinoid system and the history of cannabis as medicine, it's not anything new, would be something that we plan to incorporate in our classes. We're also thinking about incorporating a gardening type course where students can not grow cannabis, of course. That's illegal in Florida, but we'll have them grow like lavender or something and learn about terpenes that way and, other things. So just wetting the palate a little bit and helping students learn at least foundational things regarding, the endocannabinoid system and cannabis as medicine and how that all relates to the bigger picture of health. So, yeah.
Wonderful. Yeah, and I agree. I think we all agree that the the endocannabinoid system must be part of nursing education. It was actually finding out about the endocannabinoid system that sparked the anger in me that I didn't even know was there. But once I
Yeah.
learned about the ECS, I said, why in the heck didn't they teach me this? Like, what's going
Yeah.
on here? This is human biology. Why did
Yeah.
you withhold that information from me? It's so valuable.
Yeah, it's just as important as our integumentary system, our cardiovascular system. Like it's actually insane that we don't learn about it. So I'm very vocal about that at the University of Miami that we need this. And surprisingly, the higher ups agree. So we'll see what happens.
Good. And sometimes we find it's just a matter of they're not thinking about it. So they need somebody to say, hey, we need to teach a class on this. So good on you for doing that. Um, I wanted to ask you another question about your research, just kind of viewing it through like a justice lens.
Yeah.
Um, how do you ensure that your research reflects and serves the needs of historically underserved populations? And what advice would you offer other researchers who are wanting to do the same?
Oh gosh, that's a good question. Well, one of the things that I try to do in my research is always incorporate those who come from underserved communities. So, it's no secret Black individuals are disproportionately affected by cannabis use legally. So in my federal study, what I'm doing is I have a community advisory board of Black men and women who use cannabis, and they help guide the study. I also like just share my findings with this community advisory board so that they can also interpret the data for themselves. I don't believe that research should be done alone, because sometimes with researchers, what we tend to do, we get this data and people end up becoming just zeros and ones. You know, you code it, the statistics, and you put it in a paper. But I firmly believe that all research should be community engaged. That's one of the reasons why I thought forming the cannabis nurse task force was so important, and why I like including the populations I work with in my work as well, because we all have our own lens, right, in life. And even though I am a Black woman, I do believe that just incorporating a diverse spectrum of individuals in the research process from the conception to the dissemination of the work is so important, so that, the lens of your work isn't just biased to me, but it's more so encompasses the diverse thought of all people. And honestly, the people who I conduct research with, they're the experts. They're the ones that are going through, you know, the particular condition, or, the ones being affected by laws, policies, and health. So why wouldn't you include their voice in this work and just elevate it in a way? That's my thought on that. Did I answer your question?
Absolutely.
Okay.
Yeah, no, that was great. And I guess my next question would be really looking at what's ahead. So, what excites you most about the future of cannabis research in nursing?
Oh God.
And are there emerging areas of unanswered questions that you're eager to explore?
Oh man. There's so many things that excite me. Honestly, I'm curious where we'll be going federally. I mean, I don't want to get political, but I'll just say there's a lot of changes happening on a federal level. And I'm not quite sure where cannabis fits into the overall goals. Because a lot of my funding does come from um, federal funds, the National Institute of Health, and I'm not sure if you all have been following this particular news, but my study in particular has stopped because the work I focus on is Black sexual and gender minority men. So the data has stopped because that's not necessarily the priority population of the National Institute of Health at this moment. So I'm hoping that by a miracle, I can continue collecting data in this field. But I think I'm still hopeful and excited to maybe explore other areas of cannabis research. Right now, we do have a survey that is going out, I promise. It's really hard to put together surveys, I might tell you guys. But I really want to see what is the temperature in cannabis nursing. I feel like I try to Google schmoogle, see what's going on, but as far as research wise, I wanted to put out this survey to see what are the hot button issues in cannabis and nursing from the lens of you guys. So I'm hoping to put out a survey that I'm hoping you all can actually take to see, maybe are there gaps in education, cannabis nursing education? Are there gaps in regards to patients, communicating with our patients about cannabis, or even getting access to medical cannabis cards? So just asking specific questions, even in regards to AI use. Is there a way that we can incorporate AI in educating our patients? I know that's a hot button issue, but um, that's kind of where I want to go with my research at this moment in time, just looking at nurse-led models of education and patient care, and how do we best do that. Um, so I think I went all different ways. I hope I
No,
answered
that's good.
your
I have
question.
another question because as you were talking, something sparked up. And so I just wanted to ask your personal opinion. If you don't want to answer, that's fine. But what is
Okay.
your personal opinion of nurses' use of cannabis? You know what nurses go through, you know what our trauma is like. What is your opinion on nurses using cannabis?
Oh, like for their
Oh,
own
for
personal,
themselves, yes.
there's still stigma, but I think it's totally fine. I'm learning a lot from you guys in the Cannabis Nurse Task Force, and I do think there are many different ways to, and I think the word is like enhance our endocannabinoid system, not just through the plant, but through many different things. I'm also learning that you don't need a lot to get um, the desired outcomes that you're looking for. So I would say it's up to the person and the what they desire, but I do think I'm learning to explore different ways. Me personally, I'm learning to explore different ways to enhance my endocannabinoid system, and um, I still think there's also so much to learn about how to do that too, in the the best way for that person. But we're all different, right? So yeah, I hope that was a good question,
Yeah,
Heather.
thank you for answering too. I didn't want to put you on the spot or anything, but I was just curious. And then I guess my last question is just sort of a little bit lighter to sort of lighten the mood. What's the most ridiculous or funny cannabis myth that you've had to debunk as a researcher or an educator?
Oh my gosh, that's so funny. Oh my gosh, there's so many. I'm like, which one should I say? Okay, so I submitted an article the other day to a journal. I think it's called Cannabis and Cannabinoids, and the article was about you know what like the current literature on cannabis education interventions and their utility. And in the discussion section of the article, I wrote about the opportunity, this may be an opportunity for nurse-led models of patient care in cannabis nursing, especially since it's now a specialty field according to the ANA. So the reviewer, well, he rejected the article, and he basically said nurses so you're basically, the reviewer said, basically, you're telling me you want nurses to push products on patients. You want nurses, you know, basically he thought it was ridiculous that cannabis nursing was a specialty field. So I wrote back to the reviewer basically stating that educating what cannabis nurses do, we advocate for our patients, we educate our patients, we don't push cannabis on our patients at all. We just educate them about the endocannabinoid system. So I was surprised that the reviewer wrote that. Uh, and it just goes to show that education is so necessary. There's a lot of uneducated people with a lot of opinions. Um, and I don't know. I didn't know that was a stigma out there that cannabis nurses push products. So that was surprising to me. I don't know if you guys got that too, in your experiences, but that made me mad.
It's so funny because when I started up as working with patients, there really wasn't a thing called a cannabis nurse because I'm that old in it. But I remember looking it up on the internet and like, okay, cannabis nurse. And there was nothing, but what came up was 420 nurses. And I was like, oh, very interesting. What is a 420 nurse? And so when I clicked on that, what I realized it was a modeling agency of models that would go to cannabis events and they would hold the tray. They would be dressed up in their very skimpy nurses' outfits and they would have a tray with all the cannabis products on it. And they would walk around like a High Times cannabis cup, handing out. And so I spent the first few years of my nursing career, cannabis nursing career, and I would say, okay, we need to figure out what is a cannabis nurse and what is not a cannabis nurse. Because people always ask, what's a cannabis nurse? And I'd say, okay, well, we're not 420 nurses. So I had this picture of 420 nurses, and then I had a big line through it. I was like, this is not what we do here. But it is, for years now, that's kind of been the concept of what a cannabis nurse is. So I want to just thank you so much, Renessa. These were all the questions that I had. I do want to open up the floor because I know all of the folks here in the room with us probably have burning questions for you and comments. So at this stage, we'll just open the floor for any comments, questions, and engagement with Dr. Williams. So thank you so much, Renessa.
No, thank you. Thank you so much.
Hi, thank you for your talk, and I'm baby dosing on the information of cannabinoids. I'm a nurse anesthetist here in Philadelphia, and the way I've been learning is my mom has cancer, and I'm trying to treat her cancer pain. I don't know, this is open to the forum. Is there a lot with like CBD and treatment of cancer pain? In your research, or I don't know if that's the hot topics.
Oh yeah. So I'm not. I will say I have delved a little bit into that research, and I feel like maybe Nurse Laura actually may be a better person to ask this question to. But at least from the research side, I am seeing without a doubt that CBD does help with pain for sure. And I don't know, Nurse Laura, if you would like to add anything to that.
One of my biggest concerns that I know is probably why Renessa is thinking about this is that I think so many people are hearing, whether it's from Google or some other popular influencer or something about CBD and cancer, and they're not realizing that CBD in particular fights for the same receptor that some of these newer cancer drugs, especially like the HER2 breast cancer drugs, and that we really need to space it apart when we're taking those drugs and we're trying to do that therapy, because we could actually make, whichever one gets there first is the one that's going to get to do the work, and we might impair the ability of the chemotherapeutic drugs or the immune system drugs from working. So we just need to be really thoughtful, and that's why they need us, like because we can look into that and educate them on that. And it doesn't mean they can't use the CBD, because it can help for so many reasons, even if it's just the anxiety about the having to deal with this. But in talking with multiple peers on this, it just really seems like we need to give it a couple days before and a couple days after the actual treatment, so that we make sure we don't not get what we need. If you're going to go through chemo, you might as well at least let it try to work in the right way. So I think that's really important.
Yeah.
No, thank you for that. I mean, this is nice to have an open forum with nurses, because we know the pharmacodynamics of each drug, and its timing and this administration of things. And I'm trying to do that on my own, because there's no like toolkit in order to like give the timing of administration of our CBD and our gabapentin. Is it too much? Synergistically, that will get her to the top where she's not neurologically, up to where she was. Or is it the cancer itself, that's winning versus, the medications that I'm giving? So it's comforting in a bittersweet way to know that we have these struggles of, the timing of drugs and its therapeutic, value to it. But this is the reason why I'm interested in the research. So I hope to meet, Renessa. I'll be in Miami in September, so I'll have to make sure that I keep in touch with you. So
Please do. And maybe that's something we can also think about doing as a community advisory board, like coming up with toolkits, because cannabis research is so biased right now, but there are good studies. It's hard to find them. And maybe it's good to teach people how to find good studies. Um, and where to look for actual legit research information. Because yeah, there's so many sources that tell you different things, but it's not good science. So um yeah, thank you for mentioning that, Jennifer. And I'm hoping in my studies I find also the utility and efficacy of CBD um, once we get some of that data back. So Yeah,
Great question.
that's a good
And
one.
we're wishing your family member well also on their journey toward health. And I also want to acknowledge Marilyn. I know Marilyn, you just you were caring for your sister, and she recently transitioned, and so I know that that's something that's weighing on your heart right now, and we're sending you our love.
I thank you. I thank you. I felt everyone with me on that very brief journey. To her advantage, she didn't know she had cancer. So she lived about 1.5 years with it and didn't know. So it was a brief ending, but it was a glorious 1.5 years of living with it without knowing. So I think that in her case, it was an advantage. But I do have a question for you, wonderful Renessa, who is doing such wonderful research. Stigma is my big deal. I just would love to pound stigma to the ground. And I also have, you talk about cannabis nurse stigma. There is a lot of cannabis nurse stigma. Someone saw a sticker on my computer the other day and they were like, oh, Marilyn's a stoner. I'm like, no, I'm not a stoner. It's medicine. Oh my God. It was just so hard. And I just ended up in a defense mode, and it was so frustrating just because of the misunderstanding. And so I wonder, are we going to win as fighting as nurses against cannabis stigma? Because research, God bless you for doing research. There's research all over the world. Cannabis is administered legally and medically in so many other countries. Come on, we have even in Canada, they have basic guidelines, and even our own physicians now are now doing basic guidelines. There was one of the primary care doctors put out a basic guidelines like just within the last month. It's very frustrating because even when it does become legal in all the many 50 different ways it is or isn't all over the country, it's confusing, and it's usually left to physicians and pharmacists. Nurses are left out. We are not even considered, unless you are like Jennifer and in a higher in a separate entity, or you're a nurse anesthetist, or you're a professor. You're not nurses at the bedside. We're just part of the clump of the healthcare system, and we don't get a lot of credit. We don't get a lot of authority. It's very frustrating. So we're stigmatized as nurses anyway. And then on top of it, we're talking about cannabis. And so I'm almost to the point where I'm like, well, maybe what we need to do is get people on board so that enough people decide that they want cannabis available in a better way, and they want more information, and they want to use it as medicine, so that they can sway the legislators, because I feel very frustrated as a nurse to be speaking about it. I'm misunderstood, misrepresented, and no matter how much I talk about it, the stigma pounds me down 10 times backwards. And I live in Georgia, which is one of the most oppressive places to at all use cannabis. There's no leaf, even hemp leaf is illegal now. You cannot, if you smell cannabis, it's illegal here. So your thoughts on that?
Oh man, I echo your thoughts. It's so frustrating. I mean, and that's kind of why, well, it's the reason why I enjoy this community so much, because we have to help build each other up to, when we're beat down, it's like it's nice to come here and congregate with you all who are just as passionate and educated about this. Um, because when you go out into the wild, it's just like you get hammered with all of this ignorance. Just last week, I had a colleague, basically telling me cannabis was like devil's lettuce, and I'm just like, you do know I'm a cannabis researcher, right? Like, but regardless, I view all of these things as just opportunities to educate. Anytime someone hits me with ignorance, I just hit back with niceness and education. And there are some times when, they actually do get something out of it. They're like, oh, I didn't know we had an endocannabinoid system. Or there's still sometimes I still get pushback, which is fine, but even having just one person saying, "Oh, I didn't know that," I didn't know about the endocannabinoid system means the world to me. Um, but yeah, the stigma, I don't know. I think also speaking to, Nurse Heather and Nurse Laura, I always bring it back to you two because you all have been in rooms, especially politically, fighting for the rights of nurses and educating those who don't know much about cannabis as medicine. And I think we just have to make each other, we have to at least I'm speaking to myself too, just putting myself in uncomfortable rooms and educating on a larger scale, you know, um, and maybe joining even more advocacy groups or political, nurse political centered groups, and maybe being in the boardrooms or, grassroots efforts. So just being out there because we can only do so much, amongst ourselves. But I think just going out there is so important too, because how will people know, you know? And it's hard. It's easier said than done. It's easier said than done. So, um, and yeah, just platforms like these, CNN too, just letting us know about all of the happenings going on, keeping us politically aware of what's going on. Um, I know, Heather, that you post opportunities to get involved, and um, so that's important too, just being educated about what's actually going on. And sometimes it may be small, but little things I do, if there's like a news article, and it's, there's always silly news articles out about cannabis. I always like to comment, even just leaving a comment educating is something little I like to do. And I'm like, I just hope and pray someone reads it and they're like, oh, maybe I should second guess this article, um, I get off of Facebook. I can't do Facebook anymore, but I used to like to go on Facebook and, respond to relatives if they posted something ignorant about cannabis use in an article as well. So those are some of the ways I try to overcome these things. Like, what's the phrase? You attract more bees with honey. So I just try to be as nice as possible, swallow my anger and just be nice and educate. And I don't know.
That's beautiful. Thank you. That helps and encourages me. I agree. Education from an educator too, and your positive attitude. I mean, your spirit is just so positive and beautiful. Thank you so much for your work.
Thank you. Same to you. I hope we get to connect for sure.
And on that note too, I mean, one of the things that I've said for years is, you never really know what kind of impact you're going to have. And if you go into it with a plan and I'm going to do this, 9 times out of 10, it doesn't work out that way. So one of the things that I've been saying for years is, 90% is just showing up. Just show up who you are, as you are, whether it's at your city council meetings or state things or, advocacy groups or nursing, whatever it is, just show up, be there, and be willing to, like you said, be brave and speak up with kindness. People don't know what they don't know, right? And so having us in the room where we can maybe help to shift their perceptions just a little bit. We're not trying to change City Hall, but we can come and let our voices be heard. So we just so appreciate you, Renessa, and all that you're doing to help move things along.
Hey, Renessa, thank you. I'm glad to be able to be here today and listen to you talk and tell us what you're doing. And I'm just kind of in a space right now where I'm jumping into different arenas. I've been in the hospice world for 19 years, and cannabis has been part of my toolbox to educate and help patients understand what they're using, because they are using it. And hospice world is pretty okay with cannabis use here in Colorado, but maybe not everywhere else. So some of the things I'm jumping into now, I'm waiting to hear if we get a grant for healthcare providers for their attitudes on cannabis as a harm reduction for substance use disorder. So that's through the University of Colorado in Denver. So hopefully next month we'll find out and start those surveys out in mental health areas. There is so much research out there for the use of cannabis. I know too, like in, understanding oncology is a little more open-minded with the use of cannabis, and chronic pain, that's kind of, stepping on the pharmaceutical company's toes. So there's that push-pull there. I don't know. I think the stigma is still really strong, but hopefully we just keep, tapping and making little cracks in all of these places so that people's minds can open up and they can see how cannabis is helpful. I was also gonna say something. I think Jennifer was talking about the CBD, and I know Dr. Williams mentioned it too. There's so many other ways for us to work on our endocannabinoid system. And so acupuncture is what brought me to Colorado 15 years ago. I wanted to learn more about that type of medicine. And then I kind of was looking at that research going, oh my God, it's acupuncture works because it's tapping into the endocannabinoid system. No wonder you feel so blissful when you walk out of an acupuncture treatment. So, there is always the ability to maybe your mom can get some acupuncture and see how that helps her overall too with her pain. But it's great to be here with you all, and we'll just on tapping away.
We will. We'll keep on fighting the good fight. And best of luck to you on your grant. That's amazing. For even submitting it, that's amazing.
Yeah, and I think some of the mental health providers, I know Denver Health was one of them. They were actually looking at putting in some policies for their patients to use cannabis, but their policy is not there yet for nurses to use cannabis.
Thanks, Marcy.
I just had I went to a conference this past weekend, and I overheard one of my sorority sisters speaking about her son and him, and how she had to put him out because of cannabis use. So I'm like, did you know, were you aware of the fact that you have an endocannabinoid system? She was like, no, what's that? So then, of course, I get to educate her on that or whatever. And she's like, you know what? You're only one conversation away from having more knowledge about what's what. So, so then she could understand his use or maybe why he was using. I said, because some people do use it or take it because it's medicine. I mean, some people do take it to avoid other things.
Yes.
Right. Just like you would with alcohol or what have you. So I don't know if that's what he was doing. I'm like, but however, he's still at some point, some level, serving his endocannabinoid system. I mean, maybe he's just doing it, even if he's doing it just to be elevated, to lift up his mood or whatever. I mean, there's nothing wrong with that. So, it gave her such a new perspective on things. And so that made me feel good to, like you just said, you just change one person and now she'll go home and maybe talk to her husband about that.
Mm-hmm.
And then, and then I started sending her a little bits of information, especially that Rachel Knox video. I'm like, because that just sums it up, a really good synopsis or what have you, but just spreading the word and letting folks know that, number one, I did about 2-3 weeks ago, I did a whole presentation to a group of women, and they just left it up to me on what to talk about.
Mm-hmm.
Okay. And it was so juicy, and it went way longer than what it, should have done. It was only supposed to be like an hour, but they were so engaged and just banging out the questions like, oh my God. And, coming out of the closet about their use when they were just kind of keeping it hush hush so nobody else knows. But so it gave them permission to just really open up and speak about it. And I'm just looking forward to, at some point, having these hospitals allow, not only the patients, but even the nurses. Because,
Mm-hmm.
oh my God, I mean, the state of nurses, all the things that we're hearing about, the horrors that nurses endure at the bedside. I'm like, yeah, I don't know if you could pay me enough to go back to the bedside. So.
Yeah. Yeah, I don't know either, but you know, good on you for all that education. Like even in my own work, I'm finding that, well, let me back up. There's some schools of thought that say cannabis is not used recreationally. Everybody uses it medically for reasons they
Yeah.
never may not even know.
Right, right.
And in my work, I found we just did like a simple statistical analysis. We found that people who used cannabis, especially heavily, they were the ones that had mostly had anxiety. So now we're here wondering, are people using cannabis because of their anxiety? We don't know, but it could be an explanation for that finding that we found. But yeah, that's really cool that you were able to get some education there. I love it.
This has been such a great conversation. I'm so grateful we had the opportunity to spotlight you, Dr. Renessa, and the work that you do. What a gift you are to our cannabis nursing community. And I just want to thank everybody for joining us today. And this has been a thought-provoking and deeply inspiring spotlight session with Dr. Renessa Williams. Her commitment to scientific integrity, inclusive research, and advancing cannabis nursing through education and equity is nothing short of visionary. And I mean that. Let today's session inspire you to explore your role in the future of cannabis nursing, whether it's through research, advocacy, or simply starting the conversation in your community or clinical setting. Thank you, Dr. Williams, for your leadership. And thank you to our community for showing up with curiosity, courage, and heart. We look forward to seeing you at our next month's CNN Members Spotlight as we continue to grow, lead, and elevate the profession of cannabis nursing together. And until then, stay curious, stay empowered, and keep leading us forward. Thank you, everyone. Have a wonderful, wonderful day.
Thank you, everyone.